So in terms of learning objectives for today's particular lesson, I'm going to provide you a general framework for theories and apply it to practice. We're going to understand how techniques are associated with each theory. We're going to consider ways of viewing groups through multicultural lenses. We're going to understand foundations of group work. We're going to talk about psychoanalytic approaches and psychodynamic approaches, Adlerian approaches. We're going to talk about the various key concepts and techniques of experiential and relationship-oriented approaches to group work. We'll talk about behavioral approaches, postmodern approaches, and talk about integration. So that is the roadmap for today. Now, theory. What is a theory in general? A theory is a general set of principles that guides one's beliefs and actions. So when we think of a theory, it can guide you as much as a roadmap does or a navigational instrument does. It also provides you a set of directions where you are at the starting point. So that would be when your clients come in. Where you hope to be at the end point, what, if all the goals were accomplished, what it would look like, and various steps along the way, these would be the interventions you use. Now, it's very important to understand that with every plan, you need to be flexible and modify the way you approach things if you're going to accomplish your goals, because not every technique works with every person. So you want to have a flexible roadmap. Now, it's important to also talk about an integrative approach to group practice. Now, when we say an integrative approach, that's when you put pieces of different theories together and apply them. Now, most therapists, if you were to ask them, well, what is your theoretical orientation? If you were to ask a therapist, they might say, well, I'm a psychoanalytic practitioner, I'm a cognitive behavioral practitioner, I'm an existentialist, whatever it might be the answer. But we know our theoretical orientation. Now, if you were to ask me, I would actually say that I am more eclectic, where I engage in a theoretical integration of three different orientations. So I benefit very much from cognitive behavioral therapy. That is the heart of the approach that I take, exploring thoughts and feelings and reorganizing thoughts and modifying behavior that way. I also view myself from a humanistic or existential lens, trying to believe in the best in people, helping people to reach their potential and achieve their life goals, explore purpose in life, things of that nature. However, I also view myself as a psychodynamic practitioner to some degree as well, because I find that early childhood experiences shape who we are and shape our relationships. So when it comes to attachment and early childhood experience, put a lot of emphasis on the psychodynamic principles. Now, as I say this, I have considered my own personality, who I am, my own worldview, and you should do the same. When you're thinking about, well, what theoretical orientation best fits me, think about your personality, think about your unique strengths and your life experience and the worldview that you have, and there will be a series of techniques that work best for you. Now, there are different ways to achieve integration. There's technical integration, and then there's theoretical integration. And I'm going to define both of these. Technical integration is basically taking techniques from each orientation or theoretical model, but not coming to a holistic theoretical orientation, right? So you're just taking certain thought work exercises from CBT, but not figuring out how that might work into a larger framework. When you talk about a theoretical integration, which is more of an eclectic approach, you come up with a new theoretical approach that's unique to yourself. And it blends and synthesizes the multiple orientations that you align with in a way that you can engage in successful and functional therapy. So we pay attention to 3 domains. The cognitive domain, this refers to how you think. And if we were to explore one's thoughts, we will see very commonly we have faulty thinking. And there are a whole host of irrational beliefs or faulty thinking. Something like catastrophizing is a maladaptive thought process of faulty thinking where a person thinks the worst is always going to happen. So that would be an example. As it relates to the affective domain is about emotions and feelings. So we want to explore how you're feeling. Now, I have seen that sometimes one's emotions are misaligned with their thoughts. So you have to work with your clients or your group members to explore where their thoughts and emotions might not be in alignment. Or another strategy is intellectualization, when instead of talking about emotions, people talk in a very heady, logical way so that they don't have to explore their feelings. So in group therapy, you want to listen to how people are sharing their experience, because if they're overly intellectualized, you might ask them, can we go a layer deeper? Can we explore an emotion that goes with that thought, so that you're getting a more complete picture of their experience? And then the behavioral domain is what you're actually doing. And once again, our thoughts and our actions could be misaligned. And there's a concept called cognitive dissonance. And cognitive dissonance is when either our thoughts and behaviors are misaligned, where we believe one thing but we're not acting in accordance with our values, or where we have 2 competing values where we believe both of them but they're not in accordance with one another. So that's going to create some conflict or tension, which is going to require some resolution.
Question: would you build a website for a major brand with more than 200 million users using Wix? Well, we did. Hi, I'm Sivan. I'm an R&D manager here at Wix. Today I want to show you how we use our own platform, creating some pretty complex functionalities that may surprise you. First, all of our web pages are built on Wix. They get a huge amount of traffic. Users that sign up to Wix come with all kinds of needs and goals. So to match them with the best solutions, we built an onboarding flow on the Wix editor using custom code. We also embedded a web component using the custom element feature. These can be developed in any client-side technology like React, Angular, Vue.js, your call. So what now? Push to production? Well, not just yet. That's where the release manager comes in handy. It's a built-in tool that allows you to gradually roll out new versions and test
Nisha, because she.
What about it?
Therapy, we can use our techniques to tap into that and get people to realign their thoughts, emotions, and beliefs. So I already said this, but just as a reminder, an integrative conceptual approach includes the 3 domains we talked about. And I define technical eclecticism, which is taking techniques from different models, where theoretical integration is more of a synthesis of blending, where you create your own orientation that has the fullness of each of the components. So when we use group techniques effectively, our techniques are leader-based interventions that are aimed at facilitating movement within a group. So if you are a group leader, you should be thinking about facilitating growth and movement. That's going to be crucial. And as we talk about the various stages of group, it's possible for groups to stagnate. And we're going to talk about a non-working group, how you get stuck. And one of the reasons why you might have a non-working group is the group leader is not really thinking about how to facilitate that movement within the group. And we're going to talk about specific techniques, but virtually anything the group leader does could be a technique. So self-disclosure. If the group leader speaks about their personal experience, well, that actually could be used as a technique to model what you expect from other group members. Whereas from certain theoretical orientations, you want to be a reflecting pool, reflecting back their experience, but sharing very little. So you have to think about what you're going to do, what you're not going to do, how much to share. All of these can be techniques. The group leader's body language and nonverbals. This is something you're doing. You may not be attending to it, but if you make a side eye where you look at someone as if you're like, what did you say? And someone catches that, they're going to perceive you as being judgmental. And when we talk about techniques, they're very useful when they evolve from the work of the group participants, and they're specific or tailored to the situations that come from the group meeting. So long story short is that in some group approaches, you have a strategy, a pre-group meeting. You might meet with a co-facilitator and say, here, this is what we're going to do. But sometimes things can happen inside the room, the treatment room, that's a game changer. And the best techniques are the ones that are flexible and adaptive to the experiences of the members of the group. So make sure you're being fully present during the group experience. Now, in selecting techniques, you want to think about the purpose and the type of group. Not every technique is going to be as useful for each group. For example, if you're dealing with people who have...
I'm applying for tech roles and I'm struggling with resume writing. How do I ensure I'm concisely and effectively communicating my skills and experiences? Maybe I should use Grammarly.
With Grammarly, you can rewrite to polish and refine your writing for any audience to have the most impact. Let's specify we want to improve my writing by more effectively communicating. It's already so much better. Since space is limited though on a resume, let's ask Grammarly to shorten it. Perfect. We can press the insert button and then add in bullet points. Want to improve your resume too? Sign up and download Grammarly for free.
Limited insight you're not going to do a lot of the deep thought work. You might focus on the concrete expression of what they're experiencing in the moment, and not rely on thought work or the insight-driven therapy or techniques. You also want to not treat the group as one whole. You want to be mindful of each of the group members and where they are in the group process, and you want to assess the readiness for that member to talk about whatever you're probing or deal with their concerns, because you want to push a little bit beyond one's comfort zone, but you don't want to pressure people to say or do things they don't want to do. Now, I had a mentor who told me growth comes from uncomfortable places. And if you're feeling comfortable in therapy, then you're probably not doing therapy, right? Because therapy involves challenging people to become better people or achieve a goal. And if you have plateaued, that's a concern. So you do want to push people a little bit beyond their comfort zone, but you also want to provide space for the individual to say, I don't want to go there. And that every person has the right to share or not share in group. And if you see a person had a reaction and you call on them and they say, I'm not comfortable sharing, that's fine. You might scale back and say, well, if you don't feel like sharing everything that's going on, can you share how you're feeling now? Just an emotion around it. So you provide them space to get somewhat of a catharsis or release, but don't push them to a point where they're disclosing beyond their comfort zone. You also want to pay attention to cultural background and value systems and their value systems, pardon me. It's interesting that when people come to therapy, they bring their culture with them, of course. And I did a demo on culture and cultural identities in a previous lecture. But it's important to know that, for example, many Asian cultures will treat you similar to a medical doctor. You are the doctor, you are the authority, and they will want you to tell them exactly what they should do. And that seems to be against some of our rules where we help guide people, but they come to decisions on their own. But knowing what's culturally appropriate is going to be useful, knowing your authority. Now, there's a flip side to that, that treating mental health professionals like medical doctors, they assume you're going to fix them relatively quickly. So if there isn't significant change quickly, it's possible for you to lose members of especially East Asian communities. So be mindful of the cultural background and their value systems. Another example might be if you're working with the Latinx community. One of the hallmark features of the Latinx community is family. And the overarching importance of family. And when I say family, I'm not talking about the nuclear family. I'm talking about a more extended family that includes grandparents and aunts and uncles, and having a multi-generational household is important, and respecting the grandparents as matriarchs or patriarchs is going to be very important. So these are just examples. I'm not covering everything in great detail, but understanding cultural backgrounds is going to guide things. And we'll talk about feminist group therapy, and I might bring back the case of Latinx community and how males are considered more of an authority at times, and there's machismo and the importance of a man being masculine and being the dominant head of the household, and there could be problems that come from that, or women having to tend to the children or do more of the domestic stuff. These are built into cultural value systems that you need to be mindful of when you're working in a group. Now, you are going to be as successful as the level of trust your members have in you. So as a group leader, if your group members trust you, they're going to disclose, they're going to take risks, and ultimately they're going to grow. But if your group members don't trust you, then they are going to keep it very, very superficial, very shallow, and the deep insights that you're trying to accomplish or the meaningful growth that you're trying to accomplish might be undermined by the lack of trust. Also, you want to think about the level of cohesion among the members of the group and the trust that they have with one another. Now, group cohesion means that they're fused together and feel some interconnectivity with each other and a shared responsibility for one another, and they're bonded. They're bonded with one another. So the greater level of group cohesion you have, the more gains you're going to have in the group process. So long story short is you have a lot to think about when selecting techniques in group therapy. Now, viewing groups through a multicultural lens, it's very, very important to consider all dimensions of one's identity. Regardless of your theoretical orientation, it does not matter because that which is salient now may not be salient later, and something you thought wasn't important could come up as important later. So pay attention to all the domains of identity, and we did that exercise on identity and the various layers of cultural identity. You don't have one identity of many identities, so you have to pay attention to that. You also have to understand that you have power as a leader. You're in a position of authority, and people are going to view you that way. So be careful how you use the power that's bestowed upon you. Now, I personally view the process of group therapy as you give me the power in the beginning, but as soon as we start, I give it right back to you. I don't need to possess the power. I think that you will feel safer when there's a shared power and there's more of a view of egalitarianism or equality amongst the members and the group leader. So be mindful though, because you are a doctor or a future doctor or a future licensed professional, and they're going to view you as the expert, and don't abuse that. Now, you also can possibly symbolize structures of oppression for some members. And it's, for example, as a Jewish individual with a yarmulke, if I were running a group with Middle Eastern clients, it is possible that one could conflate my Jewish identity with support for Israel. And then one could see that as a level of oppression against other members of the group. Or as a male, I might symbolize certain aspects of structural oppression against women, right? Because there, as much as we're making progress, there still seems to be a glass ceiling. And I know in her concession speech in 2016, Hillary Clinton said, we made a crack in the ceiling, which is a good thing. That means that there's been progress, but there still is a glass ceiling, right? So we have to be mindful of what it means to be male in the room when running groups related to women's issues. So, and it goes on and on and on. So we might symbolize something in our group members, or being white. What does it mean to be white in a group that is largely ethnic minority, right? So I could go on and on and on, but it's very important to have these conversations safely with group members, and it's okay to hear from your group members that, you know, your perspective, you won't get it because you're white. Now that sounds potentially shocking, but no. Ken Hardy, which is a great professor at Drexel University, he talks about this all the time. It's all about your vantage point. I've never lived in the skin of a non-white individual, so I can't possibly fully get the experience of Black individuals and persons of color. That's important for me to understand when I go in there. And it's okay to have conversations around oppression. For example, I bring the elephant into the room and talk about it. So if I were doing a group with survivors or victims of domestic violence, and the group happened to be all female, I might ask, what does it mean to you that I'm a male leading this group? How does that make you feel? And does anyone feel a sense of lack of safety? And that creates a dialogue, and it allows people to talk about their experiences that they've had with oppression or discrimination, because you bring your identity in the room, other people bring their identity into the room, and it's important to be sensitive as well as have a sense of cultural humility to hear the criticisms that people have about you or the symbol that you represent in their life. Because there are many times that you may not actually be that person, but you're a symbol of all that was wrong in that person's life. All right, so now let's start to talk about the relationship between theory and techniques. So if we were to go through some of the theories or psychodynamic theories, there's a focus on stressing insight, experiential and relationship-oriented approaches, focus on your feelings as well as your subjective experience. Cognitive behavioral approaches focus on how you think and what you're doing and whether your thoughts and actions are aligned. And then we'll talk about a whole host of postmodern approaches that stress understanding the subjective world we live in and tapping into whatever resources we can for change within the individual. So let's start with psychoanalytic therapy. It's very important to understand that psychoanalytic therapy goes all the way back to Freud. Now, I could ask you, well, what's your perspective on Freud and his theories? But that is not relevant, because in the end, Freud said a lot of things that were really useful for therapy. So the emphasis on insight, or exploring the unconscious, or reorganizing one's personality structure, all of these are useful. Now, when we talk from a psychoanalytic point of view, many times these groups go on for long periods of time. So it's not necessarily short-term solution-focused therapy. You can be in group therapy for years. But what I will tell you about psychoanalytic or psychodynamic approaches to group therapy the richness and depth of your experience and learning about yourself and learning about relationships with one's parents and how that shaped your attachment, your identity, and how you interact with your romantic partners and friends, it's powerful. So one of the challenges to psychoanalytic therapy, though, is it's very costly, very expensive because it goes on and on. Now, one belief is that your early childhood experience shapes who you are. So we focus on, your first 6 years of life and, how things went with the family, whether there were any traumas or whether there are any conflicts, and we explore them, right? So the goal of psychoanalytic therapy is to make the unconscious conscious, bring things from beneath the surface to the forefront so that you can look at them and possibly work on restructuring personality. And when you restructure personality, there is a sense of release and relief that comes from that. Now, psychoanalytic therapy, I have to tell you that there's a difference between early psychoanalytic models that come from Freud and psychodynamic approaches, which are more modern approach. So the more contemporary formulation is much more useful today, shall we say. So we focus on therapeutic alliance. The therapist is not just a reflecting pool. They're in the room with you. You still use an analytic framework, right? So the id, ego, superego. You still use free association, which is saying whatever comes to mind and exploring that. We still use interpretation and dream analysis, although dream analysis is done somewhat differently today. There is still an exploration of resistance and transference. All of these were pieces of the Freudian puzzle that were carried on by many psychodynamic therapists. Now, so when we talk about psychodynamic group therapy, we want to explore transference and countertransference in the current group situation. Now, what is transference? Transference is when a member of the group superimposes feelings that they might have for another person, whether it be their parents or their boss or whatever, and they superimpose it on you as the clinician, you as the therapist. That's transference. Now, transference can be positive, negative, or erotic. So a positive transference might be that they idealize you and you might serve a role as reparenting. A negative transference is some of the resentments that they have for someone else might be put upon you. And then an erotic transference is where the client develops sexual feelings towards you, which happens rarely, but it's something to consider. Now, that's transference. Countertransference is the opposite, where in the group situation, now it's the therapist who's superimposing their feelings or their experiences in life onto the members of the group. And once again, it could be positive, negative, or erotic. So countertransference is from the clinician onto the clients, whereas transference is from the clients or group members onto the clinician. Now, that's classic psychoanalytic, psychodynamic principles. Alfred Adler was a very special individual. He was from the psychoanalytic perspective. However, he broke off from Freud and came up with his own perspectives on therapy. And he wrote the concept called individual therapy. Now, individual therapy does not mean necessarily doing therapy one-on-one, individual psychotherapy or individual analysis is studying the whole person. So there's a focus on the unity within the individual. There's the embracing of the subjective experience of that individual. And there's a spotlight on whatever your life goals are and how they direct your behavior. Now, another major piece of Adlerian therapy is something called the inferiority complex. Now, according to Adler, everybody has some natural inferiority. And inferiority is not a dirty word, right? In this context, inferiority is a lack of competence, but according to Adler, you engage in something called superiority striving, which is to take areas of inferiority and move towards competence and mastery. So that's superiority striving. So everybody has natural areas of inferiority, and growth comes from taking those areas of inferiority and making them areas of competence. So, what is an inferiority complex? Well, an inferiority complex is when the feelings of inferiority are so extreme that they paralyze you, and your sense of self-worth is impacted by that. Now, when a person has an inferiority complex, they could respond to that inferiority complex in many different ways, right? So they could quit based on their inferiority complex, or they could overcompensate in another area to demonstrate that they have competence to help them deal with their areas of inferiority. So now he also talks about style of life. Our style of life consists of our view about others, the world, and ourselves. And based on our style of life, that's gonna guide our life goals and pursuits. So in an Adlerian model, he also puts a focus on the family constellation. So he pays attention to the birth order and the structure of the family. Now, one of the interesting things, according to Adler, was that he believed strongly that birth order affected your personality. Now, research suggests that birth order has a very weak correlation with personality. It's negligible, but nevertheless, he felt that the firstborn behaves in a certain way that's distinct from the middle child, which is distinct from the youngest child. So birth order played a role in personality. He also wanted to push a sense of social interest or relatedness to the world or social responsibility. Now, in a group setting, Adler believed in a more democratic approach within the group, and he didn't screen members because he felt that that interfered with democracy. Now, one could criticize that because we said in a previous lecture that if you don't pre-screen members, it's possible that you might have individuals within the group that might undermine the growth of the group as a whole, right? So they can force stagnation or conflict in a way that might not be useful. But according to Adler, he didn't believe in pre-screening in groups because it was inconsistent with democracy. Now, Adler focuses on psychoeducation, so teaching members more about symptomology, teaching members about their life goals, teaching them about inferiority, things like that. It's present a future focus, whereas the traditional psychoanalytic perspective focused on birth to six and how that affects you now. And it's relatively brief or time limited, which is very different than the traditional psychoanalytic perspective, which was long term. Now, The therapeutic relationship is based on cooperation, trust, respect, confidence, collaboration, and alignment of goals. So when you think about that, that sounds very much like a humanistic approach. And it's interesting when I think of some of the work of Abraham Maslow and Carl Rogers and compare that to Adler, some of their beliefs are not too far off, even though they're viewed as separate schools of thought. Now, Adlerians don't follow a set of procedures. Their techniques are hodgepodge, but some of the techniques include life history, lifestyle analysis, family experiences, homework assignments similar to CBT, and offering encouragement. So if I were to encapsulate, well, what did you get? What I covered right now are the psychoanalytic and psychodynamic principles. And what you got was a little flavor of Freud and his value systems and how that affects groups from a psychoanalytic point of view. You got a little bit of flavor of more contemporary psychoanalysts or psychodynamic principles. And then you got a little bit of flavor of Alfred Adler as another one of those individuals who came from the school of thought of psychoanalysis, but branched off. Now we're going to shift a little bit. We're going to shift to more experiential and relationship-oriented approaches. And we're going to start with existentialism. So existentialism, you probably have heard the word existentialism in a philosophy course or in a history of psychology course. But existentialism focuses on things like, why are we here? And when I say here, not in the class, but on this blue marble we call Earth, right? Why are we living? What is our purpose in life? How do we make meaning or make sense of the world around us, right? These are foundational questions from an existential perspective. And so if I were to ask you, well, what is your purpose in life? You would probably look at me and say, whoa, man, that's a really heavy question you're asking. I need time to think about it. And that's okay, because in your phase of life, you're still figuring it out. Most of you are, at this point in life, emerging adults or early adulthood, where you're still figuring out who you are and what you want to do with your life. And in fact, I'll give you an example of an existential crisis. Most people, before they graduate, they have a sense of anxiety. What now? Right? So many of you who are in this course, you're in a graduate program, but you're going to graduate in about a year. What are you going to do afterwards? I'm sure the question that I ask now is eliciting some anxiety from some of you who are watching this. But that is an existential question. What are you going to do with your life? How are you going to make meaning of your life? How are you going to feel like at the end of your life, it was a life well lived? Well, thinking about graduation and then the next responsibilities of life are heavy, but they're important. If you are above the age of 25, you probably have spent some time thinking about this, and you might be able to give me more of an answer off the cuff. But most of us require time to think about this. Now, the existential perspective believes that all people have the capacity for self-awareness. All people have free will, and with that free will, you have responsibility for the choices you make. So because you can say or do whatever you want, you have to own what you say, own what you do, take responsibility for your life. So responsibility and living a meaningful life are part and parcel to the existential perspective. Now, we also have a concern to preserve our uniqueness of identity. And when we interact with others according to an existential approach, they help us better understand who we are, develop more knowledge about who we are. And also, the other members of the group are sort of checks and balances against our beliefs of the self. If I were in individual therapy, I might convince myself that I'm living in accordance with my values and I'm doing everything I'm supposed to be doing. I'm taking responsibility for my life, and the things that are going wrong in my life, I had nothing to do with the problems. Well, when you have other members in the group, they're going to push back on you and say, well, you're acting like a fly on the wall, but have you considered X, Y, Z? Have you considered how you contribute to the continuation of your own problems? So it's nice that in a group setting, when we interact with others, we get to see how others see us, and they get to challenge us on whether or not we're living in accordance with our values.
That is true. So I know we're going a little over because I had trouble starting it with volume, but I will see you all next week. So have a good one.